So, hi guys, welcome back to my YouTube channel. This is Living with Type 1 Diabetes. My name is Anita Kemboy. Karibuni sana. If you're new here, please consider subscribing. If you are a returning subscriber, karibuni sana. So, as you can see on the title of the video today, I have a guest, a very interesting person, and we have a lot. So I'll let him introduce himself, and then we'll get into the video.
All right. Thank you so much. I know we have planned to do this in the previous for a long time. Happy that it's happening right now.
Finally.
Yeah. My name is Dancun Motanya, and I am a director at most people know us as DMRC, which is Diabetes Management Resource Center, because that is initially the name that we set up with. But we now are known as DMMC, which is Diabetes Management Medical Center. So I'm a director and founder at DMRC.
I've never understood the difference, at least.
Yeah, by the way, let me tell you why this day, and it's good to say it today because I don't share it quite often. So when we went, when we applied for licenses, the medical board told us that we cannot use DMRC because of the diabetes management resource. Yes. So that's why we had to change the name to
Medical
DMMC.
Center.
Yes.
Okay.
Yeah.
So I have a few questions that I'm going to ask you, and he will expound on them. He knows best. So I will already say your name.
Yes.
I've just found out that he's not diabetic. So I would want to know why DMRC.
Yeah, that's a good question. The DMRC and the project that we're doing with diabetes is very personal to me. It's personal in the sense that my dad was living with diabetes for a very long time, and the funny thing also is that my dad was a nurse. Yeah, so my dad, the interest and the reason why I say it's personal is because as a senior parent with diabetes, managing diabetes and all that. And why it's personal is because my dad passed on in 2013, and of course he's passing on. I want to put it out there. It was not directly as a result of diabetes. He was diabetic, but he got an accident with a motorcycle. He was a rider too, and I think it caused some wound on his leg, and he typical of men. He never told the family, so we came to learn about it later on, which was slightly a bit late. So we had to go and amputate his leg, but he passed on in 2013. So why the interest is because I think when he passed on, I felt like because also I was very close to him, I felt like maybe to keep his legacy, I can start doing something that I can also help people with diabetes.
Or since you're not a nurse now, you can do something.
Yes.
Oh, okay.
Yes.
So, in line with that, now what do you do with your life apart from now running this institution?
Yes. So my background is actually sales and marketing, and but of course one of the things that I've done, or rather my career in the past 10-15 years, has been largely around financial services. So currently I work for a company called Zenka Digital. I am the country manager at Zenka. I, of course, I'm also a family person, and at the same time, that's actually more or less like what I do. I manage the Zenka business, and of course this project that I of course let people manage it and do everything, but I oversee everything from the back end.
Okay. So tell us more about your DMRC, what you do. Basically what you do, and
All right. So DMMC is what the easiest way I can explain or maybe describe it is like a primary health center or medical center that I always want to see as a specialized kind of center for diabetes, because our main focus has been, diabetes and hypertension.
Yeah.
So what we try and do, yes, we are a medical center. We are, of course, we operate a medical center. We operate a pharmacy. We operate a laboratory, and we are able to treat many conditions. But we want to be known, or rather, our bias is towards diabetes and hypertension. So that's what we do. We set up the center in 2020, but before that, you'd realize that we have been doing a lot of work online around, diabetes education, awareness, and all that.
Okay. So, one thing I find interesting about him is he eats well, he exercises a lot, and at times he sends like a screenshot of how many steps or how many kilometers he's done in a day. So what really triggers you, what really inspires you to working hours and sharing in our group, yet you're not a diabetic?
All right. I cycle and I run, and of course I always make sure that if I need to walk, if I have a choice between walking and taking a boda, I would rather walk. So I think working out and being physically sort of like fit shouldn't be tied to people with diabetes only. I feel like it's something that every other person should build into their life. But a bit of from my side, I always want to lead by example. I don't want to encourage people. And by the way, let me also tell you something which is also related to the center. One of the things that we learned from over time is that in the past we have got two models where so for example I would call it like a health model kind of approach when it comes to treating people, where you would go to the hospital, and the doctor will tell you need to do this, you need to do this, you need to do this, and you need to follow the step of what you've been told. But what we're trying to do different at DMRC is having like what we call a patient-centered model, where I come and sit with you, and I want to understand first. It's not just treatment. There are many other things that I want to work with you, but from your perspective, not from the health center's perspective. Now, why am I telling you this? This is because when you look at diabetes and like other conditions, diabetes is one of those conditions that in many ways I think like 80% the things that you can do apart from type 1 diabetes, let me make the clarity, is that can help you in controlling your blood sugar, specifically diet and working out, exercise. So I feel like of course when we talk about the three pillars of treating diabetes, you talk about medication, you talk about diet, and you talk about now the exercise. So I feel like the two areas are not well sort of like taken care of, and largely because of many reasons. So I'm happy to be like the champion to show people that you can do this, and encourage them to also partake in that.
Thank you. It really helps, because at times when I see his screenshot your kilometers, I'm like, man, I'm doing badly. I need to take a walk.
Yes, people listening, please, and I know most are guilty.
So thank you so much, guys, for watching this video. I hope you have enjoyed, and I hope you've learned about different perspectives about the institution. And if you're interested, there's a video I'll do of where the place is, and their contacts, how you can reach them, and how you can get help. So you can tell us goodbye.
Oh yeah. So thank you so much. I am usually not a very big fan of videos, but thank you for finding time to come and talk to us or talk to me. I appreciate it.
Thank you so much.
Thank you.